Hey everyone, it's Dr. Namani and Dr. Louie back again today with another episode of the Athlete Spine. And we're really excited to have Dr. David Skaggs. We've had on before. He is the co-director of the Spine Center at Cedars-Sinai Medical Center in Los Angeles, as well as Charlie Spencer, who is one of Dr. Skaggs' patients and is quarterback for the Ferris State Bulldogs in Michigan. And now has been out from his scoliosis operation and went back to play. So we thought this would be a really great topic and really fascinating, both for us as well as all of our listeners. So thanks to both of you guys for being on.
Yeah,
Glad to be
thanks
here.
for having us.
Yeah, and so we were chatting right before. I mean, when David or when Dr. Skaggs like posted that video or the picture on LinkedIn, the story, we got all these text messages like, "Wow, did you see this? There's a picture of a scoliosis and a surgery, and the guy's in a football jersey. Like, was he actually able to go back?" So this is awesome, Charlie. Why don't you take us back to, maybe high school days or whatnot? Like, what were you going through? When did you know you had a scoliosis, and how did it impact you early on?
Yeah, so honestly, I figured out I had scoliosis even way before high school, but it was so like a little curvature at the time that it wasn't anything to worry about, is what I was told. And then, I could like as I started getting to high school, you could see it on my back, like my parents would notice, and I could feel it. And then that's eventually when we started to, seek help, and I ended up meeting Dr. Skaggs in my junior, senior year of high school, and we figured out, it was a problem, but it wasn't really affecting me at the time. So,
Okay. And I saw your X-ray, presumably the one that you had before surgery, but
uh,
I guess Dr. Skaggs and Charlie, when you guys first met, what was the discussion like in terms of treatment options at that time?
I'll tell you what, I just reviewed the notes to make sure, from my perspective, he had a 60-something degree curve, and he says, "I want to play football still." I said, "Okay." That was the end of that discussion.
Yeah. Great. So that was, I guess, towards the end of your high school career, I guess, or like, sometime in high school, I guess, right?
yeah, yeah, I think it was towards the end of my senior year. And, originally I was just planning on getting the surgery, but waiting till I was done playing in college.
Yeah, 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 and it's a really interesting topic because I think this comes up a lot for us, with any patients, right? If they have important things that they have to do, and we worry that some of the limitations after surgery might affect these important activities, and in your case, playing football, and it's not an emergency, we say, okay, well, why don't we put it off a little bit, or why don't you delay it until you get done the things that you want to do, kind of end that season of your life, so to speak, right? And so let's go back to that time. Okay, so you decided that you wanted to keep playing football. You're going to put off surgery, and then obviously you finished high school and then transitioned to college.
Actually, before you answer that, I do want to say, like, typical high schooler says that I just had a little curve, and then we find out it's 67 degrees. By the way, 67 degrees is not like a little curve. That's a
Yeah,
fairly significant curve, which it
Yeah.
shows what you were playing through as well. It really
yeah.
shows how tough you were going through all that. But yeah, go ahead. Like, what was this transition from high school to college like?
Well, yeah, so I knew it was a problem, but I kind of went into college just same as always, and I didn't try and let it hinder me or affect me at all, Maybe kept an eye on it in the weight room, like in terms of like loading heavy weight on my back, but other than that, I was just playing like normal, and I got through my freshman year. And then it wasn't till like my sophomore year that I was doing my yearly checkup, with Dr. Skaggs, and that the curvature had gotten like severely worse in like the 1 year um, that I'd been playing. So, and then that was when we decided that it was probably best for me to get the surgery now instead of holding off till after college.
And so it sounds like it was more the fact that the curve was growing, and you weren't really having a lot of back pain or other symptoms from it. It was really kind of more just the growth of the curve, correct?
Yeah, it wasn't anything to do with pain or discomfort. Like, yeah, honestly, like I felt fine, but I just knew that there would be problems like later on down the line.
Yeah. And Dr. Skaggs, kind of talk us through a little bit about how to think about size of a scoliosis, what that means in terms of progression risk, what it means in terms of risk of the operation versus waiting versus dealing with it with a curve approaching or past 70 degrees?
Yeah, those are the exact right questions. I think a 50-degree curve, 60-degree curve, like you could correct it extremely safely, get a wonderful correction most of the time. In my experience, once your curve starts getting 70 and above, still it's extraordinarily unusual for someone to be paralyzed. I've never had anyone paralyzed in my career for scoliosis surgery, but you can lose signals. And all of a sudden, you can't fully straighten the spine anymore. And then people end up with a little bit more of a curved spine. So the ultimate outcome could be compromised, in my opinion, as the curves get above 70 degrees more frequently. I remember having that conversation with Charlie.
Yeah, yeah. And for everyone, when Dr. Skaggs refers to losing signals, what that means, when we're doing these operations, we have a neuromonitoring technician, and we're monitoring the function of the spinal cord in real time while doing the operation. And so this is a way that we ensure safety during surgery. So we're always checking during screw placement that there's not a screw that might have injured or pushed on the spinal cord that could cause a problem. When we're kind of cutting the spine to make sure that it's loose enough to be able to move the spine. And then most importantly, when we actually move the spine to its final position, ideally as straight as possible, but sometimes as you move the spinal cord cannot like it, and so it can get stretched or the blood supply can get interrupted at the spinal cord. And when you lose signals, that's essentially an alert that if you don't change something, that patient might wake up with a neurologic problem. And so sometimes you have to accept a smaller correction because of things like that.
Yeah, Dr. Louie, if I could add here, I don't want to make this sound scary to people because it's almost like a vital sign, like a blood pressure or temperature. We just know like, hey, this could be a problem. And as you point out, virtually 100% of the time, you can fix that problem real time.
Yeah, I mean, it's good to understand the risks of the procedure, even though, like we say, a lot of people do well. And that's because, one, you were in great hands. So one of the reasons we do this procedure is to prevent the progression of your curvature, right? Which was really important. The other, what we tell a lot of our patients is so we can let you get back to the things you enjoy in life. I don't know how many of our patients are going back and playing high-level sports, especially on the football field and as a quarterback. What was your rendition of that conversation, Charlie, initially? Because I'm sure you were wondering, can I go back, or when can I go back?
Right. Yeah, I remember when I came back for that yearly checkup and we figured out that, it was probably best for me to get the surgery now. That was, like my first question. I was like, okay, but will I be able to play after? And he was like, yeah. It was like not even a hesitation. It was just I just had to, obviously go through some recovery time. And I think it was like 3 months until I could be like pretty active again, and then 6 or something like that until it was okay for me to get hit again and be in, go do some physical contact. And I actually remember it wasn't like it was probably 6 months or something after my surgery. I had my spring game at the end of April, and I was a little scared going into it because that was the first time that I was going to be involved in a like contact situation where I could get hit. And one of my first plays, I dropped back to throw a pass, and I got hit right in the middle of the back as I threw the ball. And I remember like getting up and I was like, that didn't hurt any more than it used to. And that's when I kind of knew that, I was good.
The spring game, so that was like your own teammate getting you in the back.
Yeah, yeah.
Wow. Dr. Skaggs, what was your memory of kind of how did you think about counseling him, in terms of going back to play? Was there any different terms of a rehab protocol, after surgery for Charlie versus someone who's going back to just, a much either a sedentary lifestyle or a lifestyle without contact? Yeah.
In general, my theory on this is you can fix a broken bone, but you can't fix a broken spirit. And I really deeply believe that, and I share that with people. I think that athletics is so important for so many, young people with friends and confidence and social. And there's even been a study, if a Division I athlete is injured and can't participate in sports, the psychological hit is similar to losing a family member. It doesn't sound believable, but when any athlete can't participate, you start getting depressed. It's tough. When Charlie says he wasn't working out too hard, my notes say that he was putting 3 plates on each side when he squatted. So I think that's 315. That's who Charlie is.
Yeah. Charlie with the small curve.
Yeah.
Charlie doesn't complain. He's tough.
Squatting the 3 of us on his back. So.
Yeah, but the thing that we're all worried about with a long surgical construct, and I think he was fused from T3 to L1. I'm looking at the X-ray. Long surgical construct like that, there's an area where the stiffness hits the regular bone, and could someone become paralyzed? And this is the fear amongst spine surgeons. And I've asked a room filled with spine surgeons, has anyone ever seen someone paralyzed from this? Nobody has. So while it's certainly theoretically possible in somebody with really strong bone like him who's lifting that much, I think it's safe. I think that we also have shared responsibility. He knew what the risks was. His parents knew what the risks are. And I think that it's okay to take that risk because there's real risks and benefits. Benefits are big for sports.
Yeah. Well, and it's great to be at that age and that level of athleticism where, you are sort of like the perfect patient. You've got strong bones, you've got good muscle, you've got the will to recover,
Yes.
So Charlie, how far out are you from surgery now? And what does it feel like when you're on the field?
Yeah, so it's been a little over 2 years now, and yeah, I feel really good, honestly. It has on the field, it's had zero effect on me. I feel like the same as when I was playing before, which is so nice that it doesn't hinder me or affect me whatsoever on the field. Yeah.
Also, how much taller did you get? Can you see above your lineman now after surgery?
Yeah, no, that's funny. That was the most exciting part of the surgery. Dr. Skaggs said I was going to grow a little bit. I think I grew like an inch and a half or something like that. It's funny because I was like 5'10" and a half, and now I can say I'm 6 foot. So
Yeah.
worked out.
That's fine. This is going to be a little bit of maybe a controversial or technical question for Dr. Skaggs. So for I think nowadays we talk a lot about tethering, for thoracic curves versus fusion for thoracic curves. And I think a lot of the concern for certain people, and obviously Charlie's wouldn't been a tethering candidate, but I'm hearing Charlie, you say that you haven't really noticed any effect on your gameplay. I don't know if have you noticed an effect on your flexibility at all?
Yeah, maybe slightly in flexibility, but nothing major at all.
Yeah. So Dr. Skaggs, what are your thoughts on, just kind of, I guess any comments on, tethering for, let's say, a smaller curve athlete that requires this versus a fusion for a thoracic curve?
Yeah, so my disclosure is I help design 2 tethers, I get royalties. That said, I consider it experimental without long-term follow-up. And I think that most of the studies conclude that for a thoracic tether, people are happier getting a fusion, and the amount of motion you lose, as Charlie pointed out, isn't that significant. And I really respect the Philadelphia group that did studies in this, and they concluded that if you're going to do a thoracic fusion, there's not too much motion there to begin with, and you're not going to save much motion doing a tether. And when you do a fusion, you could really get it almost perfect. You can get it straight, you can get it derotated. So in my family members, I would hope that someone would choose a thoracic fusion over a tether.
Yeah, and I want to bring that up. It's a question that we get asked so often, and it's just really amazing to see someone who's playing at the highest level of sport, go back and do that with a thoracic fusion, right?
Yeah, I consider Charlie an inspiration to others. I'm very thankful that you would do this podcast, Charlie.
Yeah, of course, and I'm super thankful to you, and my family wanted to mention how thankful they are to you and to Elaine, one of your nurses, and you guys were so helpful through the whole process, and it really made it so much easier.
Oh, awesome. And Charlie, we want to give you the last word because there's a lot of people out there, a lot of kids, a lot of teenagers, a lot of high schoolers who are going through the same thing you are, but they just don't know because they haven't seen this before. Right. And you had to deal with making this decision with your family and a great care team. But I don't know how many people you knew that have gone through this before and are doing what you're doing. So what would you tell those people at this point in terms of like what you've gone through, what it's been like, and your encouragement to them at this point?
Yeah, I would say that, I mean, based off what I've gone through, and Dr. Skaggs, I didn't know anybody that's gone through this type of surgery, but Dr. Skaggs told me stories of people that were, wakeboarding or doing all these activities, and so I just like, if my story could help inspire anybody, it just that would mean a lot to me, and it just goes to show that there's really, there's not much you can't do after this surgery. Of course, it's going to take some time to recover, but if you just, work through it, stay on top of your recovery, then, sky's the limit. So,
That's
yeah.
great. Well, I know you've got another year of eligibility left in college, and for any employers out there, he's a finance major. You can't, this kid's got resilience, right? So,
Yeah. Thanks.
so yeah, keep an eye out for him. So, both of you guys, thank you so much for joining us today. I think this has been really educational, not only for us, but for everyone listening. So we really appreciate you both.
Have a great day. Thank you.
Yeah,
Thank you
thanks
guys
so
so
much.
much.
All right, take care, guys.
And don't forget to like and subscribe to the Athlete Spine. All right, have a good one.